Hello there, my name is Dr. George Olstein and I welcome you to my video series entitled What's Achievable in Dentistry? That's What's Achievable in Dentistry. In today's video I want to share with you two cases that I've completed which relate to tooth wear and tooth erosion. That's tooth wear and tooth erosion. A lot of people in the community suffer from this condition and are not aware that help is available. So by showing you these two cases, hopefully if you're in need of this sort of treatment, you know that we can help you. Tooth wear, tooth erosion occur because of a whole variety of reasons. A lot of people are grinding their teeth, particularly at night time. Other people have a very high acidic diet and that causes a lot of erosion. So let's have a look at these two cases. This is a lady who presented to me with a lot of tooth wear. As you can see, edges of the teeth are chipping away and the teeth are becoming shorter and shorter. She was also unhappy with the appearance of her teeth. So she had a number of crowns and veneers done, and this is the end result. Now this case has now been going for 5 years, so it shows you that things can last a fairly long time as well, and I anticipate with good care and the proper engineering, which I'll talk to you in a moment, this can last a very long time. Here's another case of a young gentleman who presented with a lot of erosion. He had a very acidic diet. If you look closely on the tops or the chewing surface of the teeth, you can probably see some brown spots there. And that's where the enamel has worn through and it is now showing the dentine. What's important about that is if it's left unchecked, the erosion can continue through the dentine, which is now a lot softer, and things can happen fairly quickly and then progress into the nerve of the tooth, or the pulp chamber as we as dentists call it, and then you end up with pain, sensitivity, maybe even abscesses, swollen faces. So it's really important to try and address this and prevent this from happening. So again, he had a series of veneers and crowns. This is a full mouth reconstruction for this gentleman. And this case is now a couple of years old, and I saw him recently and he's doing very, very well. Now the point I want to get across here is that if you have one or two teeth that need a crown or veneer, then that's fairly straightforward and easy to achieve. However, if there's a lot more teeth involved, then it really needs to be studied in detail, and I spend a lot of time initially doing what we call a functional analysis, which involves taking impressions, organizing where the bite is, setting that up into then a mechanical jaw. It's what we call an articulator, together with a whole series of photos. It gives us a lot of information to decide where the problem is and how we should go about fixing it. What's important in this situation also is that it's all engineered properly, so if you're grinding in particular, then there's a lot of forces that are exerted on the teeth and contributing to the teeth wear. So when we're making these new restorations, we have to take all of that into consideration so that you're going to end up with a result that's going to last you a long, long time. Now, a lot of dentists may say they can do this, and they probably can, but it takes a lot of expertise and a lot of training, and I'd like to say that I've been trained by a lot of excellent practitioners in the past, and I believe we can help you in a lot of ways and give you the expertise of 30 more years of dentistry. I also work with a very specialised ceramic laboratory here in Melbourne, and I think they're one of the best laboratories, if not in Australia, then certainly in Victoria. And it's really important that you do work, or a dentist does work, with a laboratory that understands what we are trying to achieve from an engineering point of view, so that the bite is evened out properly and is able to withstand the forces that I was talking about earlier. If you are in need of this sort of dentistry, please feel free to get in touch with me. I'm happy to look after you. I can offer you a complimentary initial consultation so we can have a look and see if there's something I can help you with, and being complimentary, there's no cost to you. If you need to go further, then we can delve into it in a little bit more detail. So if you want to get in touch with me, then call our number if you're happy to travel to Paran in Victoria on 03 9510 1644, or you can email us on info@olstein.com.au. Thanks for viewing this video, and I hope it's been of benefit to you. And if you're in need of some of this sort of treatment, then I look forward to looking after you at some stage in the future. Thank you once again.